Osborne, and I am excited. We got a lot of stuff we're going to cover today. First of all, we're going to talk about the authority and how authority can make you violate your values. We're going to talk about the impact of fear on your future. We're going to talk about some of the National Cancer Institute's findings on COVID. We're going to look at the four things that a majority of COVID deaths have in common. And we're going to go back and look into the past and look at the swine flu, and we're going to find out what is VAERS. And then we're going to talk a little bit about Florida and California. So I always like stories because history has a tendency to repeat itself. So in 1962, there was this famous, and actually it's now an infamous experiment by Yale University. It was a psychologist. His name was Stanley Milgram. And what he did is he wanted to test the limits of human obedience to authority. And so what he did is he instructed his study subjects, the teachers, to give electric shocks to his students. I don't know how that works, but they shocked the students to the point of extreme pain. And what they thought was, some of the students thought they were actually causing death to the other students. And it was because an authority told them to. And so the Milgram experiment, it actually clearly showed that people will act against their own judgment, right? And they'll harm another person to the extreme length simply because they're told to do so. So look, guys, our societal norms, they're rapidly changing, and there's this increasingly authoritative environment emerging. And will you, the public, continue to, I guess, blindly, lost my light there. I guess that won't work anymore. But the question is will we blindly start to obey our authoritarians, right? No matter what the consequences are. And we really have to ask that question, because the initial lockdowns, they were intended to flatten the curve, right? The COVID-19 curve. But even after that happened, even after the lockdowns ended up continuing, and sometimes, like in California, 2 and 3 times, with each lockdown, our society grew more distant and more accepting of isolation and more fearful. And I remember when the first lockdown happened, it kind of felt novel, right? Like it was like this new thing. We got to spend time with family. But by the third time, it started to feel a little onerous. And so what began as this feeling of coming together with shared hope that soon we'd be back to rubbing shoulders and shaking hands, it's now morphed into this culture of fear. And the shift from paying lip service to social solidarity and to encouraging our populace to think of itself now as disease, it represents a victory for this degraded view of humanity that's gifted to us by this culture of fear. And so those people, those who underestimate the effect of this, well, they're going to be ill prepared for future battles as we surrender to this new normal. And so the rest of us, I'm just going to ask you, we need to stand firm, right? We need to stand firm even in the face of smears and willful misrepresentations and politicizing of science, and continue to recognize and confront the real and debilitating consequences that fear has on everyday life and on our humanity right now. Right now, our children and adolescents with, they have the ones that have existing mental health issues are particularly vulnerable to being pushed over the edge. And this is due to this, like the social isolation, families and dysfunctions, and parents' worries about finances and health and news. It's just trickling down to the children and adds to those risks. Our older adults, they're struggling, including those who face lockdowns while living in long-term care facilities. They're deprived of social interaction and family visits and meals with families and activities that many will lose. And they've literally lost the will to live, and because the loved ones, and I've talked to it with my patients, they're describing their family members that are in the nursing homes of having an accelerated health decline. Look, isolation, all this in the name of lowering cases and waiting for a vaccine. So what does this mean? So the National Cancer Institute comes out and they say that people who have COVID-19 appear to be well protected against being reinfected. Okay, so we've been locking down so nobody gets infected, but actually was initially to stop to stop the spread, and then it was to stop the deaths, and then it was to lower the cases, and now the deaths and the cases are lowered. And then we changed the definition of what herd immunity is to the number of people that got vaccinated, but the vaccine doesn't prevent transmission. And so here we go. The National Cancer Institute says that if you get COVID, it protects you against being reinfected. And I think that's what's fascinating to me, that all of a sudden science has suddenly changed due to politics. The researchers found that that reinfection appears to be rare, right? It appears to be rare. So once you get it, you rarely get it a second time. And then what they said is that the study should affect national and state guidelines regarding to return to work and school. Like, do you get a vaccine passport? Shouldn't you get like a passport for actually having COVID, survived it, and now you're immune to it, right? But I don't know. Look, guys, look, you're immune to COVID if you've already had COVID. And the National Institute stated that the data from the study, it suggested that people who have a positive result appear to have like substantial immunity to SARS-CoV-2, which means that they, like I said, they have a lower risk of reinfection. And this wasn't a small study. It wasn't like they took 5 people or 10 people there. They looked at 3 million Americans, right? 3 million Americans who had already had COVID between January 1st of last year and August 23rd of last year. I don't know if you saw this making headlines. I didn't see it making headlines. So I always say that if there's something that you're not allowed to see, you have to ask why they don't want you to see it, right? You know, when they ban things from you being able to find it on the internet, why don't they want you to see this? Another thing is this, is that when they look at hospitalizations, we talked about the 4 things that most COVID deaths have in common. When they look at the hospitalizations nationwide, they're attributable to at least 1 of 4 pre-existing conditions. And you guys know these, right? Obesity, hypertension, diabetes, and heart failure. By the way, those are probably the same thing that bring people to the hospital in the first place. But there was a study that was in the Journal of American Heart Association, and they looked at about 900,000 COVID-19 hospitalizations. And this was, and as of November 18th of last year, 30% of the people that were hospitalized it was attributable to their obesity. 26% was attributable to their high blood pressure. 21% was attributable to their diabetes, and 10% it was only 10% was about with heart failure. But what was interesting is they said each condition is strongly linked, and not only this study, but in other studies, to an increase in poor outcomes for those affected with COVID-19. So I think one of the things that's interesting is they find that they suggested that 64%, look at this, 64% of all hospitalizations might have been prevented if people were actually healthy. Think about that. Like, think about if the trillions of dollars we put into trying to save the country, what if we put those trillions of dollars into just trying to get people healthy? And what's the solution? Well, nobody's talking about sugary drinks and processed foods and how bad they are, even though we know that they're bad for us, right? Those are the same things that cause those 4 conditions, but we're finding that they even have a more damaging effect on our immune system than previous research found. And that they found that foods and drinks which use fructose sweeteners, they trigger this series of responses that eventually damage our organs and leading to serious chronic health problems. This isn't news. But the problem is that information without action doesn't mean anything. Processed foods cause far more damage than just obesity and type 2 diabetes, as the researchers found. They found that, and this was from the Francis Crick Institute in London, but they found that fast food diets, they cause our immune system to be inflamed. And this will in turn cause these, what they call reactive molecules, that damage our organs and eventually cause a complete breakdown of the healthy body from functioning. Kind of sounds a little bit like COVID, right? It sounds like every other health problem that damages our organs and breaks our healthy body down and keeps it from functioning. And the result, they said, was that it's chronic health problems, diabetes, obesity. These are just early signs. See, listen to this. Diabetes and obesity are just early signs of a distressed immune system that is starting to become inflamed. So this was in the Journal of Nature Communications, but I think one of the things we have to realize is that, look, healthy people stay healthy, sick people get sick. So I always, once again, in that kind of the news of the weird, I always look back on, how history repeats itself. And I was reading about the swine flu, and a lot of, if you're, less than, 40 years old, you probably never even heard of it. But the original swine flu was well, not the original one, that was 1918. But in 1976, if you're a little bit older, you'll remember that the swine flu and there was several soldiers at Fort Dixon, New Jersey, and they started complaining of this respiratory illness, and it was diagnosed as influenza. Well, next thing you know, Merck's making the first shipment of vaccines to state health departments, but in September. Like, you thought this was Operation Warp Speed? No, this is the first warp speed there. And they started giving the first swine flu inoculations at the Indiana State Fair. And by December 16th, they suspended the vaccine program. And what they said was that of the 45 million people vaccinated against the swine flu, 450 had actually gotten something called Guillain-Barré syndrome, which was a 1 in 100,000. Like, they literally stopped this 100 million doses of vaccines because of 450 people actually had a side effect. And the vaccination program was over at that point. And then the lawyers flooded the United States attorneys general, and they, with all claims on these people that had Guillain-Barré syndrome. There was only 4,181 claims, and they filed. It was like a total of, I don't know, I think it was like $3.2 billion. And after a decade and a half, the government's going to settle 393 of those claims for about $37 million. But in total, this whole fiasco cost the taxpayers about $100 million in vaccine claimants there. So here's the thing that I want you to understand is that when we start to look at this and you say, well, that's in the past, that would never, ever happen again. That was then, this is now. And now Norway and Denmark have suspended using the AstraZeneca vaccine due to clotting risk, right? You don't see that in the news, but I see it every day as people are missing their appointments because the vaccine made them sick. They got sick after the first shot, and now they're telling me they have anxiety over the second shot. They can't lay on their side to get adjusted because their arm hurts so bad. So there's something called the adverse, it's called VAERS, the Vaccine Adverse Reporting System. And what it does is it collects, it works with this, it's part of the CDC. And what they do is they actually look at the statistics. Well, what are the statistics right now? As of, I think it was last week, there was 966 people that have died after receiving their mRNA vaccine, right? And it's not a vaccine, by the way. It's an immunologic therapeutic. That's between December 14th and February 19th. Where's the government shutting this down, right? It's double the amount of people that actually got Guillain-Barré, where they completely shut down the program. And according to VAERS right now, there's about 19,000 people, 19,000 reports that to the vaccine adverse events reporting system that people have had problems after their immunizations with the Moderna and the Pfizer vaccines. So I think that 966 people, it represents 5% of the total number of all the adverse reports. So think about that. Of those people that died, that 5%, the 86 of them died on the same day they got their shot, and then 129 of them died within the next day, and another 97 died within 2 days, and 61 died within 3 days. But a total of 514 died within a week of getting their shot. So I think the thing that's important is that we're trying to protect our elderly. 85% of those deaths occurred in people over 60. And neither the mRNA vaccine are FDA approved. They've only been approved under this emergency use authorization. They haven't been researched for safety, and this completely represents a departure from our traditional vaccines, and that they don't use any part of the suspected pathogen to stimulate the immune system. Rather, they use this thing called the nucleoside messenger RNA. And so the head of the infectious disease hospital, one of the hospitals in France, he said something that I thought was fascinating. He said that the first vaccines they're offering us aren't vaccines. They're gene therapy products. And what they do is they just inject nucleic acids, which will cause our own cells to actually produce parts of the virus. So I want you to know that the death rate following COVID mRNA shots instead of vaccines is much higher than that following the flu. And so when we try to, a lot of times we've been comparing the flu to this whole COVID thing, but the CDC, it only allows a ballpark estimation of the amount of flu deaths, right? But in the last years that we have, in 2019 and 20, the influenza season, the CDC reported that there was 51% of the United States population received the vaccine, about 170 million people. That they've reported that in that calendar year, there were only 45 deaths following the vaccination. We're at 966 right now. In 2018, there was 46 deaths. We're at 966 right now. In 2017, there were 20 deaths. We're at 966 right now. I mean, the 45 deaths in 2019, the occurrence rate was, what is it? It's like 0.0000265%. That's right now, with COVID and all the deaths that they've had from the vaccine, it's 0.0023%. That's a significant increase in the number of deaths there. So look, guys, this vaccine reporting system was put in place in the 90s to capture like the reaction, so they could start to track the reactions of vaccines, because there's no safe vaccine. The problem is it only catches a fraction of the adverse events. They estimate it's like 1 in 10 to 1 in 100 events are actually captured in this. And the thing is it's this passive reporting system, which means it relies on people to send in reports of their experiences to the CDC. And I think that the crazy thing is the head of media relations for Pfizer, he said, to date, millions of people have been vaccinated with our vaccine, and serious adverse events, including death, are unrelated to the vaccine. There's no relation to the vaccine, and they're unfortunately likely to occur at a similar rate in the general population, really, because it's interesting, if you die and you test positive for COVID, then you die from COVID. But if you die after you get the vaccine, then you die from whatever health condition that you have, or old age, right? You can't have it both ways. So the primary thing I want you to do is that if people get, like, the primary thing you want to do is that if people get infected, we need to prevent them from getting sick, right? And if you prevent them from getting sick, you'll ultimately prevent them from getting seriously ill. Guess who says this? Dr. Fauci, right? So basically, he says is that what he was basically talking about was that, look, the vaccine that's out there right now is not preventing people from getting transmitting. It's just preventing people from getting seriously ill. But what's interesting is that we're so excited about this Pfizer and Moderna vaccine rate being 95% successful. Look, it was successful in one thing, and this is what the studies show. It lessened moderate to severe COVID-19 symptoms, such as cough and headache. So it wasn't that it stopped the spread. It wasn't that it like it's this panacea, it's like the solution to all of our problems. All of our problems are still there. They said that presumably the reason why this is important, because it would lower the risk of hospitalization and death for vaccinated people. It lowers your severity of the illness, but it doesn't stop it from transmitting there. And what we know that the severity of the illness is directly attributable to your lifestyle there, and your life and your health. The vaccines were never evaluated for their ability to prevent infection and transmission. So it can't reduce infection in hospital. It can't reduce infections. It just reduces they can reduce the severity of the number of hospitalizations due to severity, right? So it's not going to affect our herd immunity. It's not going to end the pandemic, even though this, was the vaccine's primary selling point. The vaccines have been they've been talked about as involving tens of thousands of people in their trial, but only 170 of the people are reported as being diagnosed with COVID-19. So we're basing all of this hundreds of millions of people that we're trying to get vaccinated on based on the results of 170 people in the trial, where 162 of them were in the placebo group and 8 are in the vaccine group, right? And so Pfizer's saying that it's 95% effective, but that's because they're using the relative risk, not the absolute risk, which is the absolute risk of actually this vaccine making a difference is less than 1%. So look, what does this mean? This is insanity, right? We have to take responsibility for our health. Is locking us down going to do something? Has it worked in the past? Well, when we look at the death rate in California, which was 140 per 100,000 people, and Florida had a death rate of 149 per 100,000 people. Florida didn't lock down, right? 98% of their kids are in school. Florida doesn't wear masks. Florida's businesses are open. But Gavin Newsom just kept his broad restrictions in place longer than almost any other governor out there. And he lifted them more gradually than any other governor, and he repeatedly reimposed them. And this was just to be able to protect us. But when you compare apples to apples, Florida has like an older population. These are the people that are more like vulnerable. Look, 21% of Florida, like people from Florida, are 65 and older, compared to only 15%. Florida should have a significantly higher death rate than California if like the masks were protecting us, if the lockdowns were protecting us, right? Look, there was an economist at UCLA, and he looked at COVID-19 trends in 23 countries and 25 states. And after finding what his findings were, he said that there was little to no evidence that variations in public policy explain the course of the epidemic in different places. And he concluded that the legal restrictions and the effect of the lockdowns is pretty much overstated. So where do we go with this? Look, Gavin Newsom, having our best interest at heart, he recommended now doubling down on mask mandates in our state. Doubling down means that instead of just one mask, everybody's got to wear 2 masks now. Look, my suggestion, like, you can do whatever you want, okay? Whatever makes you feel comfortable, do whatever you want. But my suggestion is you just double down on your health, right? Double down on the things that you're doing to be healthy, because remember, healthy people don't get sick. I want to invite you to we have a spring cleaning time. It's time to clean out all of this stuff. We have a spring cleaning class coming up. We know that when we clean things out, we just feel better. When we clean our bodies out, we feel better. We live in a toxic world right now. And so it's time to know about toxicity. And so I want you to feel better now that you know better. There's a link down below to attend our class. If you have questions, you can always like email me at info@drtjosborne.com. You can always like private message me. Look, guys, we're here for a better world, but for a better world, we have to have a better you. So make it a great day. And just remember, who's protecting your health? You are, by asking better